I am a medical scientist. I work at the Division of Human Genetics, which is a joint department between the National Health Lab Service in South Africa and the University of Witwatersrand. So I have a joint appointment. I'm also a researcher at the university, and my main job in the department is to drive research and development. I think funding is a big issue. So I think especially in the field that we're interested in, which is rare disease research, there isn't always as many funding opportunities, especially in South Africa. And I think the second thing is maybe the skill set. So I think there's a need for unique skills in genetics and genomics, in bioinformatics. So there is a scarcity of those skills in the country, so trying to pull a team together is sometimes challenging. And then I guess the third thing is to really try and reach the patients who would be the participants in our research studies, really to find the right match and to get people involved in the research. I wouldn't say it's something that we're struggling with, but it is something that I think we need to work on to make sure that we reach as many patients as possible. I think it's different prospects. I think there's maybe a bit of a knowledge gap between academia and the public, and understanding of what research is, what it entails to be involved in a research project, and I guess sometimes a little bit of a distrust of getting involved, knowing what the benefit is to the participant themselves and to the greater community. I think it's our job as scientists and researchers to make sure that we get that message out into the public sector, and I think that really will make research participation a bit better. I think it's across the board, but I guess potentially even more so in rare diseases, just because these patients are widely spread out, maybe not always so well connected, and reaching out to them becomes difficult, especially outside of the main research hub. So we're based in Johannesburg, where we run a big genetics clinic, and we're quite well connected to the patients in the Joburg area. But reaching out to rural areas and other parts of South Africa where there aren't such services, I think is really difficult. And we'd want those patients to also benefit from the research. So I think there's work for us to do to make that possible. I think it's becoming better. I think there traditionally was very much a working in silos. It's such a small community, especially in the field of genetics, but I think that is improving by the day. I think things like working with rare diseases, working with the SA Society for Human Genetics, pulls people together to work on common issues and common problems, and I think it is getting much better. We have great collaborations with people at the University of KwaZulu-Natal, at UCT, at Stellenbosch. So I think it is getting better, and I really think that is the way to go. Collaboration and pulling together to work towards a common goal is really the way to go. Absolutely. I think the funders are really big opponents of people collaborating, especially in South Africa and also across the African continent. I think there's a lot more opportunities now from funding agents where they want to see that people on the continent are collaborating with one another and working towards a common goal, as I said before, and also kind of driving the agenda for what is important in South Africa and what is important in Africa, not having that agenda being driven from outside partners, but from the inside and from what we know is important and what is needed. As I said before, traditionally, I think people were, especially in academia, much more likely to collaborate with somebody from the UK or from the US, from overseas, than they were to collaborate with somebody in their own country or on the African continent. I think that is changing. So through endeavors like the H3 Africa Consortium, the Human Health and Hereditary Consortium, which I'm also a part of, the drive there is really to build collaborations and partnerships across Africa. I think I've seen in the last 5 years a huge change in that. we've also now met new collaborators and partners across Africa, in the DRC, in Botswana, in Zimbabwe, that we're working with and partnering with. And I think it's really exciting. I think we're really moving to shifting the goal to answering questions that are important on the African continent. I think it's really important. I think there are many ways that we can add benefits. I think it's really important to come in from a public engagement point of view and build more what we call genomic literacy among the public, so that they understand what it means when we talk about the DNA and about exomes and genome sequencing and all these wonderful new technologies. I think that's really important, but I also think it's really important that we're part of the conversation and that our data and our research is part of what is driving genomic research globally, because there are unique things to learn from the African continent, and there are, especially in rare disease, pertinent things that are going to be really beneficial to African patients that maybe is not as important for the global community, but really makes an impact locally, but also can make an impact globally. So I think we've learned things about diseases locally that we didn't know before because we weren't looking at African patients. I think garnering, government support for research, and especially for rare disease research, I think there's such a need to really implement something that is going to be focused on maternal and infant health and making services available. So funding research that is translationable and that is focused on implementation of services that is really going to help communities across the country. I think for me that is my interest and the research that I'd like to see more of in South Africa. So yeah, just getting government support and funding support for that kind of research where there's going to be a definite benefit at the end of the day to the patient would be fantastic.